Good day, I am Remy Angelic and Paharda, and I am the acting leader of Radicals. Radicals is an organization composed of 5 members that we all have the vision for the betterment of the community as we go through the pandemic. Ever since the fatal virus permeated, the whole world coordinated and worked together. National governments down to the local government units involve themselves in becoming a part of the prevention of further casualties and a solution in making certain huge adjustments. Physical distancing, prohibiting mass gatherings, lockdowns, wearing of face masks, and face shields are some of our adjustments made to cope up in these perilous times, which unfortunately means that the traditional way of living we once knew, I suppose, will soon be forgotten.
Globally, as of April 19, 2021, there have been 140,886,773 confirmed cases, including the 3,012,251 deaths reported to the World Health Organization. Coronavirus can also affect our mental health. As it spread around the world, it caused worldwide panic, fear, and concern in the population at large and among certain groups in particular, including the kids, senior citizens, healthcare providers, and other people with underlying health conditions. Due to the continuous arising of COVID-19 cases, it brought negativity to everyone. Most of us suffer from mental and emotional breakdown as we overthink a lot about our health and safety, our loved ones, and our future. Especially, it became a threat to those kids or infants, the adults or the senior citizens, the healthcare providers, and the people with underlying health conditions as the virus can quickly transmitted into them and can worsen their health condition.
According to Mayo Clinic staff, although most people with COVID-19 have mild to moderate symptoms, the disease can cause severe medical complications and lead to death in some people. Older adults or people with existing medical conditions are at a greater risk of becoming seriously ill with COVID.
COVID-19's effect on everyday life is immensely slowing the progress of the growth of the world's economy. Thousands of people have been affected by this pandemic, and they either sick because of the virus itself or how the changes implemented as the safety protocols limited our living. COVID-19 had gravely impacted large industries and the global commerce. The way of life we once knew flipped, and the others found it hard to manage vast changes.
For the preventive measures, practicing healthy lifestyle plays a vital role in supporting a well-functioning and effective immune system to help protect against infection and other diseases. Exercising regularly, eating a healthy and balanced diet, quitting smoking, drinking lots of water, taking multivitamin supplements, and getting a quality of sleep will help in strengthening our immune system and somewhat protect us against COVID-19. Observing personal hygiene is also the best weapon in any fight between human and contagious disease. The disease transmission goes from a cough or sneeze to a surface to your hand to your face, and that's how people get infected. Good hand washing really matters. If people cough or sneeze into their elbow, that limits the spread of respiratory secretions. What all of us can do together is follow basic hygiene measures that will actually slow the spread of disease in communities.
Then, we should obey the safety protocols. Under these are the following. First, practice social distancing. Second, always wear a face mask, a face shield, and other personal protective equipments or PPEs. Third, stay at home as much as possible. And fourth, avoid crowded places. Although this is far from our traditional way of living, we should obey the safety protocols set by the government so we can protect ourselves against the COVID itself and lessen the transmission of it. Lastly, monitor your health. Distinguish whether you're experiencing a flu, seasonal allergy, or coronavirus. If it gets worse, consult or seek professionals' help. For me, this is one of the factors why most of us suffer from mental and emotional breakdown, because whenever there's someone who cough or sneeze, people think of you having COVID-19 already without knowing it's just a flu. So if you're just sneezing or coughing for a short span of time, it's better to isolate yourself first inside your house or to take care of yourself twice or thrice. But if it gets worse, of course, you have to seek professional help because it's always prevention better than cure.
During COVID stages, first, stay at home to slow spread of virus and to save lives. Second, wash your hands with soap and water for 20 seconds or more. Third, stay hydrated, eat healthy foods, and take some medication.
During COVID stage number 4, when you wear a mask, you protect others as well as yourself. Wear a mask inside and outside your home if tested positive for COVID-19. Number 5. Look for emergency warning signs for COVID-19 such as difficulty breathing, persistent pain in the chest, vomiting, and flu-like symptoms. If someone is showing any of these signs, seek emergency medical care immediately. Number 6. Misinformation can put both individuals and the wider public at greater risk. So be sure that we use sources that gives accurate information about COVID-19.
After COVID stage, you must remember to first continue practicing healthy lifestyle, making healthy choices wherever possible, such as eating variety of fruits and vegetables regularly, and do some exercises will help to stay active. It is also very essential for well-being. With or without COVID-19, we should continue practicing a healthy lifestyle for better health. Second, maintain proper personal hygiene and good grooming. Proper grooming and healthy personal habits can help you ward off illnesses and feel good about yourself. To maintain proper hygiene, follow some basic regular hygiene such as bath regularly, trim your nails, washing your hands, brushing your teeth, and more. Third, obey safety protocols. After COVID-19 stage, don't be too confident that the world is totally safe and free from COVID-19. Maybe there's still few cases, so we should still follow the protocols.
Fourth, we're not fully recovered from the COVID-19 virus. We should take time to fully recover, eat healthy foods, and stay hydrated. Lastly, monitor your health, especially post-COVID condition.
So what is the difference between the normal or healthy lungs versus the lungs with the COVID-19? As we can see, the normal lungs are uniform. We can vividly see the shape of it with a little bit of gray showing the gas exchange transpiring. Meanwhile, COVID-19 lungs are more opaque and white, which shows inflammation and inactive infections. Obviously, the normal lungs is more visible than the COVID-19 lungs, and the reason why there's white thing on the COVID-19 lungs is it represents the virus and the infections that can cause mild to severe respiratory health problems aside from having coronavirus.
We have is the evacuation map. The evacuation map is also referred as film, wherein it means that we should follow and observe instructions for limited mass overcrowd. So this service aims to plot on a map certain areas that are susceptible in overcrowds. So the virus tends to spread like wildfire in places that are a bit tight. Um, when places are a bit tight, it promotes physical contact. So when we have physical contacts, it rises up the possibility that we might acquire the virus. So proceeding to the image provided, it is color coded and some areas are not colored, which is provided in the legend that it means that it is a house or apartment occupied. Then the yellow portions that are shaded means it is vacant lots meant for sale, and I believe this is off limit. So those who wander around or wants to hang out somewhere should not consider this place as free. Then pink signifies that it is a sari-sari store, and a sari-sari store is a place that is tight, so we must consider it to be limited for only 3 people. Then orange parts is a cafeteria and it is only limited to 8 people. Then violet portions shaded are bakeries, and in bakeries there should be no people lingering around since there are bakers inside, and I believe um, this might meet the 50% capacity, operational capacity of the establishment. Then blue is the clubhouse in this subdivision, and a clubhouse can hold a large group of people, and if this indicates 18 people, then it was 36. It assesses 36 people when it was possible since there was no pandemic in that time. So all of these interpretations in this image were based in the IATF Omnibus guidelines, wherein establishments, small businesses are allowed to operate at 50% operational capacity.
For the online consultation, we will give this form for the health and safety of the community. So there will be some question for you if you had some COVID-19 symptoms and some basic information. So we know what are the problems. We're the one who will be directing the information to the barangay since our website is authorized and accessible for the people on that community.
Our website is highly user-friendly and suitable for a wide range of audiences. Our theme colors were blue, green, and white to represent safety, purity, and healing. It contains a clear description of all of our programs as well as our organizational objectives. Our website is not only appealing to the eye, but it is also very informative. We have details on COVID-19, preventive measures, what to do during and after the COVID stage, evacuation maps, and online consultation is also included in our website. The team members and our contacts are listed at the bottom of the website to answer any questions you might have.
Once again, I am Renee Angelic and Fajardo of Radicals.
I'm Maria Tricia T. Bergonio.
I am Ashik Therese Menjola.
I'm Ina Marie Aguilar of Radicals.
And I'm Crystalette C. of Radicals.